Hi, I'm Dr. Sailaja Musunuri. I'm the Chief of Psychiatry and EVP of Integrative Medicine at Wood Services.
And I am Dr. Oluwafunmike Ojewoye. I am the Medical Director at the Medical Center at Woods.
We are here today to discuss the topic, unmasking medical causes of behavioral conditions in individuals with intellectual disabilities and autism. Thank you for joining us. As we start, Dr. Ojewoye, thank you for leading our medical center. We serve a lot of individuals with intellectual disabilities and autism, and a few months ago, we opened the center for community. We specialize in individuals with intellectual disabilities and autism. So can you tell us how often do you guys see as providers individuals with comorbid medical causes, and also what kind of medical conditions do you see?
So we actually see it quite often. Certain medical conditions are a little bit more common. We see a lot of ear infections, constipation, for example, seizures, individuals who have movement disorders or problems moving their arms or their legs. So a lot of medical conditions we do see in the IDD community.
Is it difficult for a provider to diagnose these medical conditions in these individuals who have like intellectual disability, autism?
Yes, it can be quite difficult at times because sometimes individuals with severe disabilities, they're not able to communicate what is going on with them. So when you're not able to communicate, it's up to the provider to use the information around them to make a diagnosis. And the information they use around them is information from their caregivers, anyone that takes care of them, information from other providers, information from their medical records. It can be extremely challenging, which is why I think most practices are not equipped at times.
Yeah, that's, I can totally understand that part. And also, maybe there are other specialists involved as well, which makes it much more difficult to gather information.
Of course, that care coordination, right? So who's going to do that work to reach out to all the specialists if you're following up with multiple specialists?
Exactly.
So you really need to develop a team who has an integrated health approach, but will also do that extra work to talk to the caregivers, to reach out to the specialists, to make sure they have the right pieces of information.
Exactly. From the psychiatry standpoint, we always tell our interdisciplinary teams that if they are noticing a change in the behavior, like, seek out your reach out to the medical provider. But now, it does make sense that, sometimes it's difficult, but, having that team involved makes it a much more easier to gather the information. For example, if a individual is engaging in self-injury, hitting themselves, or maybe aggressing towards the caregivers, or is there certain medical conditions that you commonly see with those kind of behaviors?
Right. So we have noticed that certain self-injurious behaviors may be due to a medical condition. So we always want to rule out medical condition before we just say, oh, this is just a behavioral issue. For example, if someone does have an ear infection, they may be slapping their face. If they're having a migraine headache, they may be banging their head on the wall. If they're constipated, they may also be having a behavior. So it's definitely important that we make sure we rule out any possible medical conditions before we say, okay, this is strictly behavioral. Because that also, if we don't rule it out, it also leads to medical conditions being underdiagnosed and untreated.
And also, there are sometimes simple fix, like, for example, headache, or, seasonal allergy, or constipation. Those are the treatable medical conditions. It always makes sense to rule that out first.
Yeah, it would surprise you just giving someone Excedrin migraine headaches, what that can do to alleviate any behavior that you may see.
Yeah. I think, that's one of the things with the interdisciplinary treatment. We do behavioral interventions. We always do functional behavior assessment and implement the interventions. But if it is a medical cause, whatever we do from the behavioral perspective is not going to be benefiting the individual unless we address the medical condition.
Of course.
Are there any kind of, like, just I'm curious about any cases that you have seen,
Mhm.
that if you can give an example that a
Sure.
behavioral condition ended up being a medical issue, and once the medical condition is
Sure.
addressed,
Sure.
behaviors are completely
Sure. So,
gone.
for example, we had a case where someone was having abnormal body movements. We weren't really sure what was going on. So, in that case, we sent the patient to a neurologist because they deal with the brain, with the mind. Abnormal body movements could come from
Yeah.
something going on in the mind. So, the neurologist saw the patient, sent to see an optometrist, also sent to see their primary care provider. And the reason they sent to the optometrist is because there could be something going on with a genetic disease where it's causing abnormal movements, and you can diagnose that by looking in the eye. And they also sent back to the primary care provider, like, hey, maybe there is a medical condition that occurred that was not diagnosed
Mm-hmm.
that we need to treat that's causing the abnormal movements. So it did turn out with that particular case that they had strep. And when it went untreated, it led to this abnormal body
Body
movements.
movement.
So once the strep was treated, the body movement completely resolved.
Yeah, that's a really perfect example. A simple antibiotic was helpful in treating all those
Yep,
movements, and
yep,
also maybe that was causing some frustration in
yes,
the client as well.
yes.
What advice would you give parents
Mhm.
or the caregivers when they are noticing a behavioral escalation and they think something is going on medically?
Right. So we always want to rule out any medical etiology. That's the first thing. And I would also recommend to keep preventative care appointments, especially things like dental appointments, because a toothache can really result in a behavior. Keeping those preventative appointments, ruling out medical causes, and just reaching out to your providers.
Yeah, that's really important to keep up
Hmm.
with the preventive care appointments, so that they can, lessen the burden of the medical issues.
Yes.
And are there any resources available in
Hmm.
the community for the parents to, it's not easy to take them for these appointments.
It's not, but I would also tell parents and caregivers that you are the best advocate, right? Always advocate for the needs, for the wants. Reach out to local agencies for help. Reach out to local,
Care coordination, and also county may have additional supports too.
so reach out to,
From the behavioral health standpoint, our team sometimes kind of manages those kind of care coordination.
mhm,
Maybe the integrated approach involving everybody involved in the care of the individual may be the easier way too.
mhm, mhm.
And I know at Woods Healthcare, we are completely integrated, that the behavioral health team works with the medical team. The another thing, as the medical director for the Woods Healthcare as well as the medical center, how do we stand out or differentiate? How do we differentiate ourselves from the community? What are the benefits for someone
Right.
seeking, medical care at our center?
Right. So Woods Healthcare has amazing services, and what sets us apart truly is our integrated healthcare approach with medical, behavioral, and dental all within a few walking distance from each other. You can't find that in a lot of places. We're able to easily communicate with each other, and that really reduces the burdens for
Burden.
caregivers. In
I can
addition, we have
understand.
specialists who come on site. We have neurologists, optometry, podiatry, audiology. They don't have to go elsewhere. They can come here and see those specialists. Even allied health, PT, OT, we're able to coordinate all those things. And this is what I truly believe sets out Woods Healthcare apart. In addition, we have sensory friendly environments for your loved ones.
Yeah, one-stop shop.
Yes, one
And
stop
also
shop.
we are focusing on that whole person care, which makes the whole lot of difference for the individual.
Yes, it
We are
does.
addressing, physical health, behavioral health, oral, and the specialty all at one place. Thank you for all you do.
Thank you, Dr.
Thank you.
Musunuri.